pandemic, not spending more, not putting more money in the hands of the people, that I think is something that can be reviewed at a policy level.
No, I think they if there is time, I will mention that. I mean, I think they should, now that the revenues are looking better, they should actually spend. I mean, I think there is no point in, there is no point now in not spending. I mean,
Tight purse, yeah, absolutely. Yeah.
For the first time, people are not complaining about fiscal deficit. So
good. But it's funny. Therefore, I remember explaining to me the rationale.
Right. Even hardliners like us are saying, no, you spend. So why don't?
I know. You explained to me the rationale for the 3% once in a discussion.
Right, yeah,
but then now when the US and the European countries are spending 10, 12%, what's our problem? We should, because we don't have the dollar.
No, the whole point is for them, the market for their paper is not local.
True.
I mean, the more you collect your reserves, you are putting it in their
hands. Yeah, that's system. The system works like that, right?
So it works to their advantage. You run a deficit, and then you.
Absolutely.
The reserves.
No, and also, I remember you're saying long back. This is in the early 90s. You were making the point that look, or even I think maybe Chalaya may have made the point that so much concession for corporate taxes was not required. Now we have got down to this 22% flat. I mean, this is something Trump had in the US, and Clinton is trying to raise it to 28 or whatever. So, I don't know. We have, along the way, we could have done things somewhat differently, is what I feel.
Good evening, Dr. Krishna.
Hello, good evening. Good evening.
Good evening, everyone. Thanks for joining in. I'm Dr. Krishna Shishadri. I help put together these programs for the GCCMC, which is a platform of Wipro. I've seen most of you. I've seen Dr. Angraj, and thank you so much for joining us. Dr. Shamika, I know you through your data on Twitter.
Thank you.
And
very nice to meet you.
Very nice to meet you, and good to see that it's sort of evidence and not emotion based that COVID has been running on. And Abdul, of course, helped us put together this wonderful panel. Abdul, thank you so much. We have 4 minutes. I'm sorry. Has everyone joined? Abdul, has everyone joined?
Dr. Molil will be joining after some time. And let me call Dr. Ashwini Mahajanji.
Dr. Shishadri Krishna, that's yourself. Okay. Hello, Dr. Shamika Ravi. We've not met. I'm Dr. Venkatesh Atreya. Pleased to meet you.
Oh, very nice to meet you, Dr. Atreya.
Yeah. I know you've been working with the council and all. Becoming the advisors, yes.
So, Mahesh, I'm actually in Bangalore today. I came to do something very different. So there is a dance academy called the Padma Rao Dance Academy that specializes in Kathak.
Oh.
And I spoke to and I was a keynote speaker doing a talk on rhythms and
wonderful.
The other rhythms, the circadian, the endocrine, the other kind of.
Oh, wow.
Okay.
So it's a different day for me altogether.
I'm back in Pune now.
Abdul, as usual, I will introduce you and you can introduce all the panelists and then get started.
Sure.
We will, we have extended time, so to keep it the way you want it. Hari was supposed to join, but he's stuck with several meetings, and he sends his regards to each one of you. Thanks again.
Is Dr. Roy not joining? Nathan Roy
I'll call.
or Thomas Isaac?
Yeah, they are joining. They're all joining.
Oh, okay.
Anyway, we'll have Rangarajan sir to give an introductory talk, and then we'll have the panel discussion.
Oh, Nathan Roy is here. Okay.
Dr. Gafur, one of the things that we should probably also do, once a pandemic is over, to actually get these wonderful economists into and look at the actual cost of the new economy. When we changed to a knowledge-based economy from the 90s. In fact, this is what I was talking about today, is that the onset of the NCDs in India, the diabetes and the cardiovascular epidemic in the young people, the ones. So the ones who are doing the BPOs and the late night shifts and all of these they are developing diabetes at a very, very young age, in their mid 30s and 40s. So there is a health cost to the economic development, but we've never heard of this being factored in big debate. So when this generation comes out to retirement, they're going to have so many cardiovascular illnesses and renal diseases and other and disabilities that we have not factored this into the economic development, have we? So maybe this is something that we should plan as maybe get a white paper or something out, because whenever we plan for the country and its growth, we don't take the long-term healthcare cost or even the emotional cost that for us.
But we have not built into the even the current system the health costs that you talk about, because this is only a newfangled thing.
Namaskar, I'm Dr. Gafur. Is Mahajanji with you in the meeting?
Dr. Rajan, you were saying something. Yes.
No, I was saying that we are not even currently doing that for even the current state of technology. I mean, I think it has never been part
Do you
of
think we need to start doing this, because we are already seeing the effects of these?
Yeah, but the older ways of doing things also had its own cost. I mean, I think too much of the manual labor that they were putting in, and probably they were aging much earlier than what they should be. I think this.
But Dr. Rangarajan, while I was teaching, I always drew attention of my students to this shifts that women, for example, women in the reproductive age group are doing, or when they were, say, between 18 and 25 were doing, which had long-term implications for their health and for their reproductive health and so on. So yes, I think the point to what the doctor is saying, that there are significant health implications, which are not obvious, which probably need to be, first of all, understood more carefully, empirically, data has to be collected and so on, and not simply summarized in a daily measure, but in a more comprehensive manner. We should look at these, implicit as well as explicit costs of the different patterns of work especially for young men and women, and especially more so for women whose health issues have never been addressed as adequately as that of the more dominant part of the species, the male health issues. So we talk a lot about reproductive health, but the overall health of women is something that has, not always received the attention that it requires. And we've discussed this many times, right? From Cairo onwards, it's been discussed repeatedly.
No, the point really is that the old criticism about national income, about
right,
how we are treating the contribution of women into the national income. So if you are going to add the cost, you'll have to add the income too. I mean, I think
That's a good response. Can we start? I think we have.
Krishna will start. Dr. Thomas Isaac and Dr. Majanji will start, join after some time.
Okay, perfect.
Please start.
Welcome, everyone. We are live. Thank you so much for joining us. This is a very special program that we have curated today for GCCMC. For those of you who are joining for the first time, GCCMC is a CSR platform of Wipro. It's a response that was created to the COVID-19 pandemic. This resulted in the creation of an online platform, a course on COVID-19 for general practitioners. Then, a lot of webinars for doctors on how to handle the COVID-19 pandemic. Then we realized that the impact of COVID is spreading beyond just the health issues, that families were affected, that vaccine hesitancy was a big thing. So we expanded the ambit, and Abdul was a big part of us saying, don't be exclusive to doctors. So we heeded what Abdul said, and a lot of inputs, and pretty much opened it for people to have a very, very fair, free, non-partisan dialogue. The way we have created all of these is basically through audience sourced as well as expert discussions. We have kept talks and PowerPoints to zero almost. And that has been the success of it. We've discussed the ethics of it, we've discussed the hesitancy, we've discussed the policy, and today, we have to discuss the economic impact. On a day that, post the largest vaccine drive a day ago, and today that's we have vaccinated in Australia yesterday. What Wipro has done and what GCCMC have done, we've now started going to the smaller towns. We have worked with Prasar Bharati recently, and we are creating small snippets for people to understand about vaccines and hesitancy. But today is special. I think the economics of this has never been discussed in a big way, and we are so happy to see Dr. Rangarajan here giving the keynote, and an eminent panel here that should give us a lot of strength, a lot of understanding. And of course, someone who I admire a lot, Dr. Jayaprakash Mulir. I met him many years ago when I started working on medical education. And welcome, Dr. Mulir. It's so wonderful to have you here. So Abdul Ghafoor has been our infectious disease specialist. His enthusiasm has been infectious, to say the least. His passion, his non-partisan interest in creating these programs that we asked him to curate once in 3 months. And this was his own baby. He wanted the economics to be discussed. Abdul, I will not stay between you and the audience. Take this meeting forward. Thank you so much. You're muted, Abdul.
You're asking me?
Go ahead, Abdul.
Yeah. Good evening. The COVID pandemic has inflicted a devastating impact on the lives and livelihood of our citizens. Therefore, we need a good pandemic control strategy that should strike a balance between the measures to save lives and livelihood. And we medical experts always advise governments to implement all possible measures to reduce death, while our economists advise strategies that help to minimize the economic damage. The world is now familiar with the recommendation of our medical experts, but the medical community and the general public are still largely unfamiliar with the complexity of the economic issues and the decisions of the economists. That's why we are organizing this panel discussion, the economic impact of the pandemic, the other side of the saga. This is an attempt to bring together the top economists in our country so that we can listen to their expert opinion on the various strategies adopted by the economists during the pandemic control and what their strategies are to revive our COVID-inflicted economy. And today we are very lucky to have the real most eminent figures in the field of economics in our country. Dr. C. Rangarajan doesn't need an introduction to anybody, even to non-economists. He's one of the most eminent and senior figures in the field of economics in our country. Rangarajan sir was the former governor of Reserve Bank of India and the former chair of the Economic Advisory Council to the Prime Minister, Dr. Manmohan Singh. It's a real honor to have Rangarajan sir giving an introductory talk to the meeting. Welcome, sir.
Okay. Thank you, Dr. Ghafoor. I shall speak a little bit this evening on the economic impact of COVID-19. There are many things to be said, but I'm sure that the other panelists, eminent members of the panel, will take it up. The world, including India, is passing through a very severe economic crisis. But this economic crisis is unique in one way. In recent memory, this is the first economic crisis that has been triggered by a non-economic factor, pandemic, COVID-19 in this case. The impact of the advent of COVID-19 has resulted in enormous human tragedy. It has also had a serious impact on the economy because of the steps that had to be taken to prevent the spread of the virus. Most importantly, the lockdown. The human tragedy is that the world over, the estimate is that 45 lakhs of people have died. 4.5 million people have died. The highest is perhaps in the United States with something like 6.4 lakh, followed by Brazil, which is about 5.8 lakh. And then comes India with 4.4 lakh. There are some doubts raised about the veracity of the numbers, particularly the Indian numbers. But even as it stands at 4.4 lakhs, is an enormous tragedy. And if you look at the way in which it has happened, as you all know, the first wave resulted in about 1.3 lakh. And it is in the second wave, it resulted in the death of 2.3 lakhs of people. This is the phenomenon that is happening all over the world. The number of deaths in the second wave is almost twice the number of deaths in the first wave. And that is because of the nature of the infection, about which you will know more. The economic impact is essentially because of the need to prevent the spread of the virus. And that could be done only by imposing severe lockdowns, which essentially means the lack of mobility of people and of goods. People were not able to go to their offices, to their workshops, to their factories. And in the same way, the lack of mobility in the movement of goods essentially meant that the supply chain was very seriously disrupted. The economic impact is essentially resulted in the reduction in the total output of the country. And the total output of the country is measured by what we call the GDP, the gross domestic product. And during 2021, which is the first year of the advent of COVID, India's output contracted by 7.3%. I mean, this is a very serious happening. Normally, we talk in terms of growth rates in positive terms. Very rarely you come across a situation in which the output itself contracts, and it contracted by 7.3%. There are other countries which have had a similar fate. For example, in UK, it was about 9.8. The contraction was 9.8. And in France, it was 8.1. In the United States, it was much less. It was 3.5% contraction in output. But as you know, that they never allowed a serious lockdown, and therefore the number of deaths, even in the first wave, was very high in the United States. Now, if you look at what happened in 2021 in terms of the economic impact, the reduction in the output was the highest in the first quarter, that is April, May, June of 2020. And in that quarter, the output was reduced by 24.4%. Essentially, we are talking of a contraction by 1/4. And in the second quarter, it was minus 7.4. In quarter three, there was a small positive, 0.5. And in quarter four, again, there was a small positive of 1.5. So you can see the relationship. Basically, what happened was that as the restrictions were tightened and tightened, the output fell because of the lack of mobility, as I called. So as we relaxed a little bit, as we moved from the first quarter to the second quarter to the third quarter, the output started picking up. But there's also another thing. The economic impact was not only in terms of the contraction of the total output, but certain segments of the society were more severely affected as a consequence of this contraction. Daily wage earners, migrant labor, they were all very severely affected because they don't have permanence in their jobs. And therefore, when factory was closed, automatically these daily wage earners and the migrant labor were thrown out of jobs. So this created a scene which was very similar to what one saw at the time of the partition. Millions of people crossing from one place to another place. I can tell you, according to the 2011 population census, the number of migrant workers was estimated at 41 million people. It's a huge, that is, in terms of crores of people, it's really 4 crores of people. So there was a contraction in output. There is a severity of the impact was felt much more by the daily wage earners and other vulnerable groups. So as we move further to 21, 22, we thought at one time that the COVID impact will come down. That is what we saw in the quarter 4 of 2021. But the second wave came, and it was at the height in April, May, June, and even in July. Now, this did really affect the output, but not the same way in which it happened in 2021. That is because in the second period, we did not impose the lockdown in the same way as we did in 2021. We did insist, or the government or the authorities did insist on people wearing the mask and so on and so forth. I will come back if that time permits to make some comment on that. But the point really is the lockdown was not that severe as it was in 2021 first quarter. Therefore, as a consequence of this, output increased in quarter 1 of 21-22. And as you must all read very recently, the output increased by 20%. Now, normally this number will look a staggering number, an increase in the output by 20%. But please remember that the output fell by 24.4% in the corresponding quarter of that. And in order to compensate for it, the required rate of growth in this year is something like 32%. Because, as you know, from 100, it would fell to 75. From 75 to go to 100, you need 33 and 1/3%. So as compared to that, the 20% rate of growth, however good it may look, even though it is a good sign, it still did not compensate for the decline in the output in the first quarter of 2021. As you know, before the advent of COVID-2, the COVID second wave, many analysts, including international organizations, had expected that India's growth rate in 21-22 will be 12.5%. They all scaled it down after the advent of COVID second wave. Then both the Reserve Bank of India and others, IMF also, have estimated the rate of growth in the current year to be 9.5%. Now, this 9.5%, in my opinion, may be achievable during the year. Of course, on the assumption, A, there will be no third wave, and secondly, that there will be no need to impose too many restrictions or too severe lockdown. Because in the 3 quarters, we need to grow about 6.8%, calculations will show, in order to come back, in order to reach the 9.5% growth during 21-22. So, in my opinion, it is possible to achieve that. But as I shall point out a little later, that is not in any way adequate. But there are some sections of the economy which are still under great strain. Agriculture is reasonably doing well, and manufacturing has also picked up. But there are service sectors like hospitality and so on. I think there is one big service sector which we call trade, transport, and tourism, and so on. It's a big service sector, and that has not yet picked up. Therefore, it is possible that it may take more time, because after all, look at the hospitality or the tourism sector. Unless people travel very easily and smoothly, this is not going to pick up. So before I conclude, what I want to say in terms of where we went wrong or where we could have done better and what we need to do in the year ahead. Fortunately, the gross tax revenue of the government of India has been picking up. In April, July, the growth rate was 83.1%, which is in fact, over the previous year, even over 2019-20, which is the pre-COVID year, it has been about 29.1%. If you look at the sector in GDP, which is called public administration, defense, and other services, which is essentially the government sector, it actually, the expenditure went down by 4.6% in 2021. I think that need not have happened. I think that they should have pushed up the government expenditure more. Now that a space is opening up now, because of the good revenue performance, what the government of India should be doing is to raise the government expenditure. And there is no need, because the revenue is picking up, to reduce the fiscal deficit of 6.8% mentioned in the budget. And what they should do is use the additional revenue that is forthcoming to increase the expenditures, particularly on the healthcare and in taking care of certain vulnerable groups which have been very severely affected. So, as we look back, the lockdown was necessary. I think at that particular point, nobody had a very clear idea of what is going to happen. After all, at that point, there was no vaccine available. There was no regular drug available to cure that thing also, to cure that virus. Therefore, at that particular time, it was necessary to impose the lockdown because we had no other information available at that time. But I must say one thing. People always used to accuse economists of saying that they never agree on anything. Whenever you get a group of economists, they're always expressing different opinions. I was a bit amused during this particular period that even doctors do not agree. And I found that different opinions being given at this time. Somebody says this should be done. Somebody says, no, that is not necessary to be done. But anyway, to come back, I will say that lockdown was necessary. As I said earlier, government expenditure should have been increased in 2021. And we should have taken care of migrant labor in a better way. And the second wave also exposed the inadequate hospital facilities that are available in our country. The lower middle class and the people below that depend exclusively on the government hospitals. And therefore, what we found was that the number of deaths increased not only because of the mutation in the virus and so on and so forth, but also because of the inadequate facilities in the hospitals. Even though I didn't hear even the doctors before that talking a great deal about the lack of availability of oxygen or ventilators. All this came only as we were experiencing the problems. But certainly it exposed, in my opinion, the weaknesses in our system. So, and in addition to it, I think we also did not impose adequate restrictions on the crowding of people. For example, allowing the Kumbh Mela was a grievous mistake. I think that kind of a thing should not be permitted. I believe that in general, the need to curtail the crowding or the celebration of whatever function it is in the public should have been handled more severely. Of course, on vaccination, there were some hesitancy on the part of the center to meet the total cost. Finally, they have come around happily to do it, but it is still a very large amount. I think people should not think that it is something, it's a small amount. Originally, they had provided in the budget 45,000 crores, but that was only half of it. I think it is almost going to be 1 lakh crore, which should be the cost of vaccination. But fortunately, it is picking up now. And the doctors will tell you what is the required, what is the required target. But certainly, I think that India is fortunate to be one of those countries, one of those developing countries, which could produce domestically the vaccine. At least we are now 2 companies producing. Perhaps we will soon have another one and perhaps another. And then by December 19, by the end of December of this year, that should be an honest effort to see that at least the number of people who get the first jab, the first dose itself is as high as the covering the entire adult population. The adult population estimate is about something like 94 crores of 93 crore of people, and that should be covered. So to summarize, let me, the point is that apart from the human tragedy, the economic impact is severe. It resulted in the decline in output in 2021. If there is no third wave, and if we take adequate precautions, insist on people wearing the mask, insist on people not crowding, and so on, then perhaps the output during the current year will pick up. But please remember, even if India grows at 9.5% in the current year, 21-22, it declined by 7.3% last year. Therefore, the 2 years taken together, the rate of growth of the economy is about 2% or 1% per annum. This is a far cry from even the lowest trend rate growth of 5%. We have lost 2 years, completely lost 2 years. It is going to be very difficult to make up the lost output. What is really required is a strong incentive to get the growth rate up. I think the critical year will be not 21-22, the critical year will be 22-23, and see whether we can get the rate of growth up. Some years ago, people were talking about India becoming a $5 trillion economy. We have lost 2 years. India's GDP in dollar terms was 2.7 trillion in 2019-20. In 2022 beginning, we will still be $2.7 trillion. If we have to get to $5 trillion, we need to grow at 8 to 9% for a continuous 5 years. I am of the opinion that growth is the answer to many of our socio-economic problems. It is only in the high growth phase we were able to introduce the Rural Employment Guarantee Scheme, extended food security, and many other things. Growth gives you the resources to the government, places in the hands of the government, resources which are necessary to meet the needs of the vulnerable groups. As somebody said, growth by itself is not adequate, but growth is a necessary, if not be a sufficient condition, but for growth. But we really need to ensure that the higher growth also results in equity. But at the same time, we must understand equity will remain a dream unless it is supported by high growth triggered by reforms. Thank you very much.
Thank you, sir. Thank you, Rangarajan, sir, for simplifying the highly complex topic of economics in a very, very simple way so that ordinary doctors and ordinary member of the audience could understand. The only technical term that you used is GDP, and that most members of the audience, including doctors, know. So thank you very much. And just summarizing for the sake of my fellow doctors and other members in the audience. So what you stressed was the maximum negative impact to the economy was during the first wave, and the maximum negative impact to the human lives was during the second wave. And we could have taken care of the migrant population in a better way. We could have improved our expenditure better last year. And we have to improve our expenditure this year as well.
Correct. Yes. Thank you. Yeah.
Rangarajan sir has made a special request. Sir will not be able to stay back for the panel discussion. So the other members of the panelists and the members of the audience, if you want to ask any doubts to Rangarajan sir, please discuss now.
Maybe they want to listen to others also. So I think maybe you can.
So what should the country really do to improve the economy? What will be your advice in summary?
No, I think that's a very wide question. I mean, I think to answer that, you will have to have another webinar. But the basic thing is that, as I had argued, that as I mentioned in the last sentence, reforms are needed in the country. And I think we should really be able to tap the capabilities of the people. But reforms do not automatically lead to growth. One of the things that we have seen in the recent period has been the fall in the investment rate. normally reforms are investor friendly, but sometimes it does not. And therefore, we really need to take care of raising the investment rate. That is one of the key things in developing economies. In developed economies, people always talk about demand generation as the key to economic growth. That is true in a developing economy too, at some particular points. But ultimately, sustained growth can be maintained only by maintaining a high level of investment rate. That is the spur of the growth. So we call it simply by an equation, G, the growth rate, is equal to the savings of the investment rate divided by the incremental capital output ratio. That is really the most important thing. That is, it depends upon two things. One, the amount of investment that the economy is making. Two, on the productivity of the investment. Because you may throw in more and more investment, but if the productivity goes down, then it doesn't. Therefore, the two factors, the productivity of capital and the amount of investment that the society is making, if the two are combined, then the rate of growth of the economy can increase. Obviously, there are many, many other complications. We need to look at every sector of the economy and see what are the problems that are confronted by each sector in order to be able to move forward. The textile sector may have problems which are very different from the telecom sector or some other health sector. Therefore, we really need to understand very clearly the bottlenecks that are coming in the way of investment in each of the sectors. And that is why I have been writing that we had a big bang reform, or what we call a paradigm shift in 1991. We don't need a paradigm shift now. We need to look at each sector of the economy and see how its productivity and efficiency can be increased, what needs to be done. And if we do that, along with increasing the investment rate and maintain the productivity, we can move forward. That is said very simply, but I think to put it into action, it is a lot more difficult. But to summarize it in 1 minute, that would be my answer to you.
Thank you, sir. Any?
Yes.
Dr. Rangarajan, I have a question for you. I'm Thomas Isaac. Now, in a recent note that you published, you had compared the performance during the first quarter of this year with the last year and had shown the worst performer was of the aggregate demand was the government expenditure, which was in fact lower than that of the COVID year, 2020-21. My question is, do you see any prospects of this policy being reversed in near future?
No, let me correct you one thing. The government expenditure or the sector that I talked about, public administration, defense and other services, was lower in 2020-21 by minus 4.6% as compared to the previous year. In 21-22, in the current year which is running, in the first quarter it has picked up. It is a positive thing. But what I am worried about is that as the revenues are improving, the government might think that let us cut the fiscal deficit instead of maintaining the expenditures or increasing the expenditures. But I think that they are changing. I think there are some indications of their attitude. They have come up with many measures, what they call PLI, production-linked incentives and so on and so forth. Therefore, we need to keep telling people that it is important to see that the government expenditure is maintained at a certain level, and particularly that don't stint on healthcare expenditures or whatever expenditures that are required in order to take care of the people who have been affected by the virus. So I think they will do that because they also would want to show a higher growth this year. But the point really is the numbers have been put before them. I have written also on that some time ago. Therefore, I do hope that better wisdom will prevail and they will increase the government expenditure.
Thank you, sir.
Okay, right. Thank you very much. Okay, right.
Any other doubts to Rangarathan, sir?
Can I
Thank
take
you.
leave now?
Thank you, sir. Thanks a
Right.
lot for joining. It's an
Yeah,
honor.
right. Okay. Okay. I'm sorry I'm not able to stay for health reasons. I have to just stop it here. Right? Okay.
Thank you, sir.
Yeah.
Let's move on to the panel discussion. And we have a team of eminent panelists to discuss the important topic of economic impact of the COVID pandemic. We have Dr. Ashwini Mahajan. He's an eminent economist. He's the co-convener of the Swadeshi Jagran Manch, that is the economic wing of the RSS. Dr. Mahajanji and his organization are well known to take very strong stand for any policy changes that support the Indian industry and against any efforts by international multinational corporation to influence the Indian economy. As Dr. Mahajanji, welcome to the meeting. We have Dr. Thomas Isaac, and Dr. Thomas Isaac sir is a very famous economist, a politician, and the former finance minister of Kerala. And Isaac sir is very well known to very enthusiastic individual and well known to express, to speak from his heart. And I am from Kerala, sir. We are proud to, we are so happy to have you here. We'll be very, very happy to listen to your opinion. And we have Dr. Shamika Ravi, a very eminent economist, and I would say the star in the field of economists. Just look at the Twitter followers Dr. Shamika ji have got. And the reason is Dr. Shamika ji has been very, very open about her opinion. And if you follow her Twitter for 1 month, you can have a postgraduate degree in economics. And Dr. Shamika ji, welcome, and we are honored to have you here. And we have Dr. Ratin Roy. Dr. Ratin Roy was one of the former Economic Advisory Council members to the Prime Minister. And Dr. Ratin Roy's every annual budget analysis is highly sought after by the country. Dr. Roy, welcome to the meeting. We have Dr. Venkatesh Acharya, a very famous economist, I would say a Marxian economist. He's a visiting professor in economics to several universities across the world, and he has been to many advisory committees to the government. And we would be very interested to hear Dr. Venkatesh Acharya's leftist perspective of the economic reforms that we would like to hear to you, sir. We have Dr. Jayaprakash Moolil, a very renowned epidemiologist. He was a former dean of Christian Medical College, Vellore, and he is the chairperson of the scientific committee of the National Institute of Epidemiology. And we know that we need a balance between saving lives and saving livelihood. And experts like Dr. Jayaprakash Moolil has been advising the Indian government and many state governments on the policies that needs to be done from the medical community, from the perspective of the medical community. And then we have a team of expert economists to provide us the perspective from the economic community. And quite often these two advices do not match. We like lockdown. Medical experts like lockdown overall, and the economists do not like lockdown because that harm the economy. And what we need is a balanced approach by both the medical experts and economic experts advising the governments, sitting together so that we can have a balanced approach of managing saving lives and saving livelihood. We're all honored to have such an eminent team of economists and epidemiologists along with us. Dr. Mahajanji, I would ask you one doubt. In March 2020, our country decided for an immediate lockdown. This extreme measure was as per the recommendation of the medical experts. The decision to lock down was taken with a very good intention to save lives from an alien virus. But unfortunately, the first lockdown resulted in a severe blow to our economy, with a Q1 GDP of the last financial year contracting by 24.4% and generated other significant social issues, including the problem to migrant laborers. Now, on a retrospective analysis, it's very easy to do retrospective analysis because we doctors like retrospective analysis. As emergency physicians, we see patients coming to emergency unconscious, and we have to make a diagnosis in 2 or 3 minutes. And quite often we are right, and quite often we are wrong. At the same time, as pathologists, we get days or hours to analyze the situation, to do postmortem. So looking back now, would we have followed a different approach? Now we know what the virus is, what the damage has been done to the economy by the virus and our measures. Could we have followed a different approach if we would have known how the virus would have behaved?
Thank you, Dr. Abdul Ghaffur. In fact, it's a very difficult question to be asked from any person. In fact, if we look back, the kind of situation that had come at that point of time, word over, the pandemic had taken over. So at that point of time, the government, with all good intentions, took this decision to complete lockdown. But as you have already said, that if we look at it from the angle of the second spell, and we didn't go for the complete lockdown, because by that time we could understand the impact of the lockdown was very bad, and as a result, we learned from our past mistake that yes, we should not go for the complete lockdown, and this is what the government did. So we should appreciate the government for not going for the complete lockdown in the second phase, but at the same time, we need to appreciate the government that since we didn't know anything about it. So, but the only problem is that our friend Dr. Ratin Roy, he has been very emotionally charged with the issue of migrant labor at that point of time, certainly when the lockdown was imposed. But I would say, in fact, if you allow me to say a few words on this whole idea of growth. See, in the yesteryears, in the last 30 years, or even before that, we have been over-obsessed with the idea of having the GDP growth, and the GDP growth can solve all sorts of problems. And as Dr. Rangarajan was saying, that yes, it gives us resources which can be distributed for those who are deprived, those who are left behind, and that is the way forward. But in this pandemic, during this pandemic, we have learned a lesson that all these years of growth has not made the life good for the majority of the people, especially the labor, which migrated labor, which we found going back to the villages barefooted, without any resources, without any convenience, and the kind of, and all of our heart was weeping at that point of time. What we have done so far in these years, why despite all this growth, high rate of growth of 8 to 10%, we could not improve the lives of our people. So that gives us an opportunity to think back and see what this growth has done to us. Therefore, what I'm saying is that the first lockdown had given us various lessons. And one of those lessons is that we have learned that this growth is not good if we do not think in terms of the humanitarian approach. Yes, we must have growth. We must achieve 5 trillion, 10 trillion economy. But at what cost? Should we do it at the cost of our labor? Should we do it at the cost of our farmers? No. And this pandemic has given us this lesson. And that's the reason why now government is thinking of, let us forget about this over dependence on FDI and the kind of growth pattern which we have adopted, the growth model which we have adopted. Let us think of taking this growth to the people. Let us think of the decentralization. Let us think of the self-reliance of villages, self-reliance of districts, self-reliance of the states, self-reliance of India. So what I would say is that this pandemic in the very first phase had given us so many lessons, and I think I see the brighter picture of these lessons. That yes, okay, now we have learned this lesson. Now let us make a course correction. This is what I would say. Thank you.
Thank you, Dr. Mahajanji. Dr. Ratin Roy, what's your opinion on that particular question? Dr. Roy?
You're muted. Ratinji?
Yes, well, thank you, Dr. Gafoor, for inviting me. I apologize for initiating this lying down, but I will now sit down. The trouble, as you medical people know, is I had very bad COVID. So my ability to sit for a long time is limited. I can walk 10 miles. Quite interesting for you doctors. I can walk 10 kilometers and I don't feel anything. But if I sit for 20 minutes, I feel like an arthritic. Anyway, so I actually was very sort of, as usual, although Ashwini Mahajanji and I perhaps don't come from exactly the same ideological place, though we share a lot ideologically, was very, very comforted to hear his words. He said two things which I think the country is in dire need of. One is the lessons that this entire migrant labor crisis have taught us. This is not about the government. This is about this country and how we perceive our common economic future and the need for course correction. I think that is very urgently needed. And I deeply regret that although Dr. Mahajan belongs to the current political dispensation, he is not a part of the government, because that is not something that I'm persuaded those in government believe is necessary. Let me start though by the more important issue. And again, here Ashwini and I agree a lot. It's not this or that government that is more important, it is our society. And what migrant labor crisis told me about our society, I can explain through personal examples. See, my great-grandfather, I'm from Maharashtra. My great-grandfather moved to Maharashtra from my paternal side. Mother's side is from Hyderabad. But from what is now Bangladesh, 115 years ago. They were from Bangladesh. My first generation lived, in a Bengali community. Second generation, as my father was born in Bombay, became more Maharashtra. At no point were we ever made to feel that we were migrants in Maharashtra. To the extent that I was able to teach the Shiv Sena a thing or two about Marathi. But at no point did any of us believe that we were, in a sense, migrant. Because you see, the use of the word migrant is more applicable to an Indian in Dubai or in London, who is not an immigrant. It means you will go back. And the expectation is that you go back. And the development story of this country, and this is very important for healthcare, and the development model we followed was all about making sure that our biggest strength, which was an abundant and cheap labor force, was exploited. But the word exploited can be benevolent and it can be malevolent. And I think what happened in the course of the folding out of the development model X 1990 was that, when you develop and you become more prosperous, how does prosperity go up? It goes up when people who are earning less earn a little more, right? But what we had was a model where in one half of our country, people didn't earn much more than they did in 2010 or in 25 or in 2000 than they did in 1990 or 1985, unless they were able to move temporarily, leaving friends and family at home thousands of kilometers to earn a livelihood. Because India did not take employment to them, they had to take their employment from the north of the country and the east of the country to the west of the country and the south of the country. So did my great-grandfather. But then there was no question that that he moved from one location to another in one country, and therefore he could participate, raise a family, and prosper without having to worry, for he was a citizen of India, even colonial India, and then free India. That does not seem to be the case anymore. The fact that two things happened there. One is that migrant laborers felt more secure away from their workplaces in their locations. Same thing happened with Kerala, but that is understandable. People from Kerala went to Dubai and they came back from Dubai. Why wouldn't they? It's not their country. But I thought this was our country. The second thing that happened, which is quite frightening, is that Dr. Agarajan told you that our GDP fell. That means we earned less, right? The country made less output, earned less income than it did before the pandemic, okay? But you also hear stories about a profit-led recovery, which means that some companies and a stock market boom. What does that mean? That basically means that some companies that made profits in the formal sector sold less and made more money. Those of us who earn labor income, those of us who are unlucky enough not to have sarkari jobs because they were paid their full salaries. We had less work, so we earned less money. Those of us who had put income in the bank earned less money because there was no one to lend to, right? But some people made more money by selling less. I bring that to you again. Made more money by selling less. I'm not talking about Max Hospital here. You made more money by selling more, fine, good luck to you. I'm an economist, I have no quarrel with that. So a combination of what I saw with migrant labor and the profit-led recovery led me to believe that the big lesson I have learned from the pandemic is that our growth path has been so iniquitous that it has become fragile because of that inequity, which manifests in a number of dimensions. I'll give you a couple of examples and then conclude. You know, I'm wearing this shirt. It's an old shirt, but it'll do. This is a Marks and Spencer shirt. Now it will cost about 3,000 rupees. It's 90% made in India. 90%. And if you want to go and buy a 200 or 300 rupee shirt, 85% of them are imported from Bangladesh and Vietnam. Do you know why? Because I've talked to people in Tirupur who produce these shirts and in South Gujarat, because we cannot compete with them on labor cost. Now, I don't understand. I thought that we were a labor-abundant country, but then I'm told, no, the labor costs in South Gujarat and Tirupur are not competitive with Bangladesh or Vietnam. Fine. Then why don't you go to where labor costs are competitive? The majority of the people live in UP and Bihar. There is no skills problem anymore because the people who are working in the shop floors in Surat and in Tirupur are people from UP, Bihar, Bengal, Jharkhand. They have the skills to make shirts. They have the skills to supervise people to make shirts. But no shirt unit is set up. Now, Jharkhand is doing it in a very small way. In the hinterland of the country where the majority live, this has resulted in profound regional inequality and a hugely inefficient system where we are bringing hundreds of thousands of laborers every year in the railways to work in hotels in Kerala, to work in hotels in Goa, to work on the shop floor in Gujarat, and then sending them back. In short, the west and south of India in this growth model has become like some kind of third-class Dubai. So Keralites go to Dubai and their places taken by people from UP and Bihar who emigrate, right? This pattern of economic development has to change. And it can change by changing the priority we give to what we produce in this country. Because that will then lead, in my view, to a more secure country, a more equal country. If we produce, and this is what is called Antyodaya, I'm quite amazed that this government has paid no attention to a philosophy that emanated from its own, Deen Dayal Upadhyay ji. It's something that resonated with Gandhi. It is something that resonated with Ambedkar. It is something that is part of our heritage as Indians, cross-party. Produce what the producer wishes to consume. ideally where the producer is located. So if you can create the conditions to make sure that we have a lot of people working in agriculture, that the agriculture sector, and this was, I think, at the heart of doubling farmers' income, that the agriculture sector becomes a place where some people can earn a livelihood in a non-subsidized way, just like you and I do. If we can make more 200 rupee shirts in this country instead of importing them, and not be dependent entirely on 3,000 rupee shirts. If we can build affordable housing, ticket size 5 lakhs and below, instead of building these monstrosities in Gachibowli and Gurgaon, and the same cement and coal and steel can go into producing that. If we can have an affordable, non-subsidized healthcare system, I leave it to you whether through universal health coverage or education or insurance or what, and a good quality education system that is affordable by people who go and work and pay for these things with their own pockets, not through government largesse or feudalism. Across the cities, villages, and towns of India, if we have that output composition of demand giving us 60% of our growth, this is where I agree with Ashwini ji, 20% comes from the current leading indicators of the Indian economy, automobiles, air travel, stuff that the top 10%, 5% consume. And the remaining 20% comes from exports. We'll have a stable economy. By doing this, you'll have solved the employment problem because the sectors I'm mentioning to you are full of jobs. Jobs are not created. Jobs occur as a result of choosing activities. And we have chosen the wrong pattern of activities since 1990, and we need to course correct for that. If we are able to therefore change what we produce and for whom we produce, and not through government handouts, not through welfareism, but by ensuring that people earn enough in these occupations to be able to buy these simple things of life for themselves and their families, I think we will have moved to a more sustainable model, a model that will either require less migration or be more accepting of migrants, because terms and conditions of living would have equalized somewhat greater than they have now, right? And would also result, I think, finally, in a greater level of fraternity in our society. And that is a big impediment to economic growth in our society. We are a low fraternity society. I'll give you an example and stop. Delhi police, I don't know how many of you have been to Delhi. It's like Hyderabad. Traffic in India is a constant reminder to me that India is not a law-abiding country. Forget bigger things. Okay? Nobody obeys traffic rules without extreme coercion. So the Delhi police in 2018, when I did this study, imposed 4 million traffic violating challans, fines. You can't say the Delhi police is not doing its job. That's a lot of fines. Go and look at Delhi traffic today. And it is because a lot of law abiding depends on a mutual understanding that abiding in laws is a positive sub-game for everybody. If you and I both obey the law, then there is less need for policing. It is less expensive to run a country. It is less expensive to govern it. Whereas if you don't have fraternity, maybe because of the caste system, I don't know, then obeying laws becomes very difficult because then you're always antagonistic to each other. There's a lot of that antagonism, lack of low fraternity, which is why you don't have queues because of shortages. All those things go or become less important when society is not just economically, politically, socially, gender-wise, more equal. And that ingredient of equality, I think, is essential to raise economic productivity in this country. I learned all these things from COVID in conclusion, because COVID, of course, was a medical crisis, of course, had economic implications, but also was something that we had to face as a society with all our limitations, all our strengths. We made decisions about old people and young people. We took decisions not to send children to school or to send children to school. We took decisions about letting people travel back to their villages or not letting people travel back to their villages. We took decisions on whether people would buy vaccines or not buy vaccines. All those decisions happen within a social context. And that social context teaches me that we need going forward a far more equitable economic arrangement than we get by looking to an FDI-led, essentially unequalizing growth model that we have been dreaming of and aspiring to for the past 20 years. That is also something that will contribute to growth, but it cannot be the leading edge in a society such as ours. Thank you.
You are muted. You are muted.
Dr. Jayaprakash Mulliyal has made a special request, and he would like to say a few words about the epidemiological perspective of the pandemic.
Thank you very much. It's a privilege to be with you, and I hope my voice is clear enough because we're having some problem with the network. Now, I hope to use this opportunity to actually ask for an apology for misleading the medical community in general, I don't think did a good job in informing the rest of you in terms of what is the reality of the pandemic in advance. And I think many of the overreactions are due to the misunderstanding. For the simple reason, you have to understand this is an infectious disease transmitted from person to person. And in these kind of situations, measles, chickenpox, there is no way you can stop these infection. And the only thing that will stop is when it reaches a level of immunity in the community, it will stop on its own. We are helpless. We have no technology that we have so far developed to stop it, except vaccination. Even then, the spread is not guaranteed to be stopped. What will reduce is the severity of the disease. Now, the whole pandemic control on a war footing was based on the belief that you can make the virus come to a dead stop. It is an impossible conclusion. It is not warranted. Had you not taken that step, things would have been much better. There is one way you can reduce transmission, and that is at the level of the individual exposure. Individuals can protect themselves. That is the best way to do it, and you all know that. But what we did was we disempowered people completely. We chose a solution which is okay for a developed country like New Zealand with sparsely populated, well-to-do people, not for India, not for Dharavi, okay, not for our millions of laborers working all over. That solution was absolutely wrong. And I don't blame any other group or the government for it, because our advice was not strong enough to say, you got to face it, and face it at an individual level. Make sure you remember that this particular virus never touched children seriously. Young adults, young women know that it didn't touch seriously. The main group which was affected was the elderly. Okay, even now it remains the same dictum. The age-specific mortality rate has not changed. One of the things there was a refusal to accept, even now, is that one infection with COVID gives you robust, long-lasting immunity. In fact, I remember Dr. Abdul Ghaffur pleading with people, at least let that knowledge that the person has been infected be accepted as a defense against future infection. He pleaded, let them get away with one vaccine. That is good enough. It is, in fact, science shows now they are true statement. Very good immunity. Now, India's main asset today is a large number of people who have been infected with COVID and they recovered. And we published that number, but we don't understand how important that one variable is. There are doubts about how long the vaccine will work. We know it doesn't reduce, it reduces transmission, not doesn't come to complete zero. So the most important thing is to recognize our strength. The strength being a large number are already infected. Those days when there was infection due to smallpox spreading, the rule those days was that when somebody develops smallpox, the person who will look after is a person previously infected with smallpox. It holds good even now for us. But we did not accept it. Who did not? Medical fraternity. That is our problem. There were voices here and there telling, listen, this is very good immunity. Now, I'm only pleading with you people who are at the helm of affairs and economic future, carving the economic future of the country. Treat this disease as one. And there, we did pay in times of people dying because we had no other option. Our infrastructural problem, you all know now. And even Dr. Mahajan was graceful enough to say that probably we didn't do well in the first lockdown. There's a misunderstanding. Yeah, I agree. But today we are wiser. I think the last thing you should touch in any crisis situation is the little communities and the power to respond, individuals to power to respond. You don't lock them up. That is a poor way of meeting any crisis. But that was based on fear. And I hope this lesson will be remembered and always kept in mind. We win battles from a point of strength, not a point of fear. And I'm so grateful that Abdul Ghaffur invited me for the session, and I want to stop here.
Thank you, sir. Thank you very much for spelling out the truth in a very, very clear way. Thanks a lot for attending this meeting. Thank you, sir. Dr. Shami Gaji. Various
Yes.
states had impact from the economic, from in different levels. Looking at the Maharashtra, the state was seriously affected by the COVID pandemic, one of the most COVID inflicted states. How Maharashtra is going to deal with the financial situation that the COVID pandemic inflicted?
So, Dr. Ghaffur, if I may, I think, so far, it's not just this particular question you have posed to me, which is on Maharashtra. But you see, for the longest time, we have been only treating the symptom. Now I'm talking in the language that the doctors are familiar with. We are yet to really identify the disease. It's high time we recognize that for a resource-poor economy, I think most of the responses that you have seen, whether at the center or I would say at state levels, and I suspect going forward, you are likely to see that at the district, perhaps even at resident welfare, colony level, etc. Policy responses in this crisis has largely been because of fear and uncertainty. And that fear and uncertainty, if you can fight that either through real-time information, real-time, proper, transparent communication, but most importantly, remember the health infrastructure of this country is the reality based on which the policy responses are happening. I wrote against the lockdown right from the beginning because I knew what the economic costs are going to be. And as economists, that is what our primary fear was. But I am a health economist. I have been looking at healthcare in India and the health economics of it for the last 10 years. And I can tell you that this did not come to me as a surprise, that it was perhaps the only pragmatic response, because now you are saying that the first wave was milder. But remember, having a 24% decline in the first quarter on the back of what was at that point a mild first wave for India compared to almost all other OECD countries where you were seeing, if you remember Western Europe, Belgium, Italy, there were really fearful, very, very scary stories emerging from there. But we also knew what the reality of India's healthcare system, the infrastructure is. So, we cannot live in a utopian world and pretend that we can mimic OECD countries while having the health infrastructure of, I dare say, in many parts of the country, we are a third world country. So we have aspirations. And I must say that while I do, we are talking about doctors and how there was a lot of miscommunication, and I'm very glad Dr. Mulil has put it so succinctly, but I think this is where the economic community also has to come out. And I would say mostly the macro people who have been at the helm of affairs of determining economic policy in India, that we have dealt with human capital. Healthcare is a social subject, not very glamorous. Most economists don't want to deal with it. Most bureaucrats don't want to deal with it. And yet it's fundamental to human capital. So given the reality of the health infrastructure, the response at that time was, pragmatic. It was very long. It was a very, the period of unlockdown was too long. It should have happened quicker. But we also lose 4 lakh approximately. This is an ICMR estimate. We lose around 4 lakh people to tuberculosis every year. This is a long-term reality that infectious diseases have been taking a huge toll on India's human capital for years now. COVID has just put this problem at the center and none of us can escape it. But those of us who have been studying this have been, deeply anguished at the lack of, focus from the research and the economics community in particular, because it's my community. Around 18% of deaths in India can be, and this is a Lancet paper we published 6 months back, around 17.8% of our deaths in India are attributed to pollution. My own estimates have shown, and these are highly cited, these are old published papers, 7% of impoverishment in India happens due to healthcare. None of this is news. So I'm a little puzzled and amused when we think that COVID has suddenly jolted people to wake up and smell the coffee. It is an immediate problem which is staring everyone in the face. But healthcare has always been the weakest link in India's economy. And we know that any chain is as weak, as strong as the weakest link. So our human capital, I think, investments, we remain the only major emerging market, which has not made the requisite investment into healthcare over the last many, many decades. It's only now that we are beginning to recognize and try to reverse that through an attempt towards universal healthcare coverage, etc., etc. But you can't expect the OECD type responses, and I think that is where the naivety is. Now, our own estimates, again, we have estimated using government data available that, we have had very severe decline in consumption. This is, we see the migrant because it is in our face, it has been covered by the media. But every quintile of the population, other than the top 20%, has suffered a very serious decline in consumption. And the worst decline is actually of the middle class. And these are silent killers. You see, just because people are not familiar with the numbers and media doesn't quite recognize a lot of this, because it is not as obvious. The decline is a long-term one now. And it is, the responses have to be appropriate. I have been saying, and I again take this platform to say, that the only recovery, economic recovery out of this pandemic really goes through healthcare. If we are able to assure people, despite we have vaccination coverage today, close to 65% of our eligible adult population has been vaccinated at least with 1 dose, which is very good. I'm also amazed at the speed with which finally we are able to vaccinate more and more people. But I think economic recovery, the best response is if we can give a credible assurance to our citizens that, look, we have the vaccine, but more importantly, we have a bed, we have a bed available. If you fall sick in your block or your district hospital, we have enough beds to be able to take care of X number of patients. I think that kind of real-time information, if people know, and ready availability of tests, which by the way, even 8-9 months back was a problem. During the peak, it remains a problem. It was. But today, those facilities are far more than we had even anticipated, let's say last summer. So I think in terms of manufacturing and providing some of those, like PPEs, masks, etc., we've done a good job. But I think at the heart of it lies the fragility of India's public health infrastructure. If we can credibly assure people that we have this infrastructure, if you fall seriously sick, we have the means to take care of you. Economic recovery is going to depend on that, because a lot of mobility curtailment, a lot of demand decline. Right now, when people say give cash, and a lot of, I think, left-leaning or I think naive economists have been promoting that give cash to people, it will take care of the problem. No, when you give cash to people who are essentially scared, they will save it. It will go towards precautionary saving. We have to get to this at the heart. And really, the only means to do that is through giving credible healthcare information on healthcare infrastructure. Get to the issue of fear and uncertainty, because it is fear and uncertainty that is driving investment decision, consumption decision, and overall the economic recovery that we are facing today. In fact, I would say that is the reason that our first quarter decline was so severe, despite the fact that deaths per million were much lower than any of the OECD country, but our decline was much more severe. Why? Because we were fearful. We just did not have the requisite health infrastructure to take care of the problem. So I think, COVID has put this problem to the center of, and it is true for every state. It is true for states and very large number of states in our country. Remember, 75% of India's healthcare is private. But infectious diseases can only be dealt with on the back of public health infrastructure. In economics, we call it negative externalities. If you get infected, then other people will get infected from you. So private healthcare's response and capability to take care of negative externality is limited, which is why TB fundamentally still remains a public health crisis. Private health infrastructure is not going to be able to solve the problem. So we have to get to the heart of some of these diseases and not, just keep fighting symptoms. And for the longest time, and Dr. Rangarajan's address was very interesting, economists have shied away from addressing some of these core problems of human capital. And India remains, we are an emerging market, but unless we cure this fundamental problem of making healthcare, making it that core, that cornerstone on which economic growth will happen, we will continue to fight shadows. Today we have one epidemic, tomorrow there will be some other problem. And that's why I gave you the example of TB, that to those of you who are familiar, it is not a new problem. COVID has just, it's a new virus, but we have been living with infectious diseases and it has not been talked about. It has not been that immediate and it has not been that personal for many of you who are, elite urban folks. So I just, I want to just put that in the larger context. And sorry, I'm not taking your specific question of Maharashtra. I do think a short answer to that is Maharashtra learned from the first wave. In fact, the handling of the first wave, there were lots of problems. Administratively, you could see that, the kind of, in fact, we wrote a case study comparing Bombay's response with Kasaragod. Kasaragod, the northernmost district of Kerala. We wrote that case study to see, look at the difference in the way contact tracing is being done. Because if you can get to the heart of cluster buster is what, a lot of the epidemiology literature calls it. If you can really identify these super spreaders and get, try to curtail those, eventually you might be able to curtail the transmission. Thank you, Dr. Ghaffur. Yeah.
Thank you very much. Isaac, sir, Kerala is facing a special challenge. We have, unlike other states in the country, we have a remittance and consumerist-based economy, and we need special measures to revive our economy. What are your expectations of our economy, and what help we need from the other areas, including the central government and other places?
Kerala today presents a very curious case study. The state did exemplary well in the first wave, but today it accounts for more than 50% of the caseload. But I think what Dr. Jayaprakash said has some relevance to the case of Kerala. There's a fundamental number that we have got to remember. According to zero prevalence survey, Kerala's prevalence rate is half the national average. This has been so consistently over the last 3 surveys. The latest has not yet come out. That's number one. Second, the case fatality rate is the lowest. But I think is not sufficient to compare the fatality rate. We have to make some estimate regarding the excess deaths. In fact, we have an astounding figure that has been given by none other than our previous economic advisor to the government of India, Dr. Subramanian. It's an astounding number, which comes to more than 10 times the official number of deaths. In fact, that's one response of mine to the position taken by Dr. Jayaprakash. See the kind of a strategical approach it takes, let the disease come and go, and you are getting insulated against future virus attack, has a cost in terms of death. Look at the number of deaths. It's not the economic numbers, it's the sheer number of human death. Has such a thing occurred ever in the post-independent history after the Great Bengal famine? And I think we'll have to wait for the next census figures to come to make an accurate account of the number of devastating deaths in India. Second, the kind of lack of medical treatment facilities. Or in the urban areas, in the rural countryside, what is the facility available? And that has serious implications for post-COVID problems, health problems. So this has a very serious cost. The strategy of a lax approach, let it come. What is required medically is vaccine. That's the most important. We are the vaccine capital of the world and so on. But at this rate, we are not going to get everybody vaccinated even by the end of the year. That's very clear. The rate, there's no point in looking at the absolute number of people vaccinated. Look at the percentage of people that have been vaccinated. And where are we? So Kerala started. The point that I want to make is that the spread of the disease is one of the lowest in India, as per the survey. Now, and therefore vulnerability is much higher. And also the fact that the elderly population is much higher than proportion is rest of the states. And there is a limit. You can ask people to voluntarily stay indoors. The first wave people did comply is not just lockdown alone. The lockdown was accompanied by a kind of support system, which is, I think, unparalleled in the rest of the country. Ever since the lockdown was declared, we have been supplying a special food kit to every household. Not just grains, but condiments, pulses, tea, and so on and so forth. And secondly, consumption loans were made available. And we front-loaded a whole lot of expenditure so that money goes to the hands of people. But there is a limit to which a state government by itself can keep on supporting the poor. A livelihood after some time comes to the forefront. And therefore, it was very difficult to keep on clamping the lockdown. People became lax, particularly after the elections, regarding even the contact tracing, on which Shamika gave such a good comment. But we have become lax on that. Therefore, we have taken a position. Okay, it is inevitable, given the absence of vaccine, that the caseload is going to increase. But there are two conditions which will adhere to. We will see the caseload never overwhelms the health facilities in Kerala. Yes, public health facilities in Kerala is much better than the rest of India. And at no time did we permit, even under the second wave, the caseloads overwhelming our first-line COVID treatment centers, domiciliary centers, and COVID hospitals. And second, the say ICU beds and so on, oxygen availability. So much so, it has been possible to keep down the fatality rate very low. And adequate treatment would mean that the severity of post-COVID problems, ailments might be low. Now, this strategy becomes very important because Kerala is one region which is affected very severely by the COVID for two reasons. Our remittances constitute around 30% of our GSDP, and that's drying up. And second, our most dynamic sector is tourism, which has totally fallen to disarray. Now, these are two factors that we can do pretty nothing. State government cannot do anything regarding this, or even national government regarding these two factors. And therefore, it is very important we have an exit strategy which will focus upon protection of livelihood, particularly in agriculture, small-scale sectors, and so on. In fact, that is the strategy that we are pursuing. A major campaign for improvement in the food availability, food security program, and also a massive program for creation of food processing job opportunities. So, on the whole, if you look, that's where national government policy becomes very important. Government of India has to increase the expenditure. The four components of the aggregate demand, export alone is the one where India has done very well. In fact, it's much above the pre-COVID period for whatever reasons. But consumption is still lower than pre-COVID. Investment is pre-COVID. And mind you, government expenditure is even lower than, say, last year. That's a very, very strange situation. I think there is no explanation for this. Of course, people may save the money, which I think is still overstated. But I think if government is very worried about, say, fiscal deficit, I have one simple solution. You extend as loan to the NREG workers the total emoluments they earned last year as an advance to be recouped over, say, next 5 years if you want. So that government accounting, it becomes a loan, a capital expenditure, not a revenue expenditure. It does not affect the fiscal deficit. But some money goes into the hands of the people. Because remember, the recovery is not going to be kind of V-shaped for the simple fact, even before COVID, we were sliding down. And the previous year to COVID, it was already 4%. What happened? What started this roll down? Demonetization. Anybody with elementary knowledge of economics would understand, sucking out the entire money, the aggregate demand will just fall. And some people thought, okay, it's for a few months and therefore you pump back the money, then everything revived. Most of the MSME sector, etc., which folded up, never now showed green shoots. And that's why we were declining now. Now, take the case of COVID. What is the impact upon the MSME sector? Are they going to automatically come up? So there is a very, very important government of India, not only just be worried about the NPA, how to take care of it to the bad banks, or through now asset monetization, thing to gather money for infrastructure. Also give some serious thought to what is happening to our MSME sector, small scale sector, and even agriculture. Because within that large framework only, the state governments can positively chalk out a way forward. And lastly, I would say, at least this COVID should wake up India from this total neglect of the health sector. If you take internationally, which are the states, countries which have done well to deal with COVID? These are precisely countries which have some public health system still going on. And if there is any lesson to be carried from Kerala, I think it is that. So now, this is a perfect occasion to have a major investment in the public health system so that we don't face the situation of the second wave, the third wave comes. We are prepared. And can be done. But it means a more proactive government in public health dealing with MSME sector. Thank you, David.
Thank you, Isaac sir, for giving a nice summary of the good work Kerala did in saving lives. Dr. Venkatesh Atreya, so what do you think of the situation several states, especially Tamil Nadu, is facing? You're muted, sir. Your voice is muted.
Dr. Gafur, that you should be pleased that I'm still around, because I thought it would never get here. But anyway, we are at the fag end of our program, although you had been insisting that I participate. And I told you after Isaac was on board, I said, leave me out of it. Isaac is there. Let's say he takes care of both of us. But you wouldn't listen. So anyway, I think most of the points that need to be made have been made by other panelists. And I've learned a great deal listening to all of them. But I think the points that Dr. Shamika Ravi made and point that Dr. Isaac made, they are very consistent. The importance of greater investment in public health infrastructure, greater attention to healthcare and so on. But I also want to say that we are probably being overly complacent and relying on short public memory in looking at how we dealt with the first wave and going by the official numbers. See, first of all, the numbers of deaths that we are all talking about, because there's nothing else in our hands, these are gross underestimates, as a point that has been made by many other people. And secondly, the plight of migrant workers is something that we can't simply efface from our memory, of that woman in the station who was dead and whose child was, trying to talk, reach out to her. So why did we not try to implement a more differentiated lockdown at the national level? I mean, Dr. Shamika made the point that lockdown alone cannot be a solution. I also recognize that the information base in March 2020 must have been quite inadequate for us to make a very differentiated lockdown across the country. But some information, for example, the broad rural-urban distinction was already available. There could have been a much more differentiated approach to lockdown, even in 2020. And the point that Isaac made, which I was going to make with some detail, we knew that even before the pandemic arrived, officially Kerala had first case on January 30th, and then the February 1st, the budget was being presented. 2020, what I remind you, was being presented. This government came back in 2019, July. From then onward, the economy had been slowing down considerably. There were at least 3 official reports which told you that the economy was doing very well. First of all, there was a continuing farmers' crisis. Second, there was the employment and unemployment survey, 11-12 to 17-18, which showed a huge rise in unemployment rates. Third, there was the consumer expenditure survey data, which the government didn't want published and managed so far to not get it published fully, which also showed us a decline in purchasing power across the country, especially in rural India. So when the pandemic arrived, we were already having an economy which is characterized by very poor and low purchasing power and an incipient demand problem in the country. But what did the government do? It kept on providing more and more tax concessions to the corporates. Throughout that period, and I can give you the numbers. You had this by the finance minister's own, Nirmala Sitharaman's own assessment. The August 2019 tax concessions gave 1 point from in the reduced tax rate. She said 1.45 lakh crores is the loss of revenue. There was 50,000 crores for exports, 25,000 crores for housing and real estate. So even before the budget arrived, we had given about 2.15 lakh crores to the corporates. The budget announced a further direct tax reduction of around 65,000 crores. So after gifting about 3 lakh crores to a handful of corporates and very rich people, you turned around and said, we'll increase indirect taxes and we will try and sell public sector assets. You talk about Atmanirbhar, and you're selling public sector assets at a rate that is incredible, that no other government before has done. So, we cannot be so gentle and kind on how the government has dealt with the pandemic and the underlying economic policy, which has been a serious problem. I was very glad to hear both Dr. Mahajan and Dr. Ratin Roy speak today, gave me a different angle to their outlook on economic policy. And certainly it is not what you might often assume it to be. The standard neoliberal dispensation was bad enough in terms of, as a point has been made by Ratin and others, that it did not raise average income to lower level incomes. But on top of the neoliberal dispensation, which is already increasing inequality and putting no premium on employment, you had the disastrous exercise of demonetization in 2016 and a very, very hurried, very incompetent, and completely ridiculous implementation of GST. You had the government reneging on the promise to pay compensation later on, talking about acts of God. This has been a very dismal show, to be honest. Now, this is not a forum to do postmortem. I'm very happy that many good points have been made here, which we can take forward. But I don't think we should just simply ignore some lessons that came from this crisis. And I think some of them have been put very well by some of the participants. Obviously, public health care is important, although I am not particularly fond of the term human capital, because it completely inverts the whole process, whereby human beings create assets, and they become identified as a form of capital. But the point is well taken, that we need to put more money into human beings' capabilities in terms of education, healthcare, and we need a proactive state that undertakes investment expenditure of a kind that is necessary and that is not likely to be taken up by the private sector. So this headlong rush into privatization, and literally now with this national asset monetization program, literally throwing assets away at rock bottom prices, although ostensibly this is only rental for a finite period, all these are really steps in the wrong direction. If you're serious about reviving the economy, you should be willing to run a larger deficit, undertake much more public investment expenditure in key areas like health and education and infrastructure of the kind that is not profitable but necessary for the country. The notion that profit takes care of everything doesn't make sense. We obviously, everybody here is agreed on this now after listening to both Mahajan and Ratin. I'm convinced that we're all, basically aware that something more needs to be done by not necessarily the state in every instance. And this brings me to the next point, which is that in the pandemic period, and this is a consistent feature of the present government, unfortunately, after all the rhetoric of cooperative federalism, there was gross over-centralization in the handling of the pandemic. It began to get better as we went on into the pandemic, and now it's a little better than it was earlier. But certainly there's been a huge amount of over-centralization, a huge amount of denial of states' entitlements, forcing states to borrow at absurdly high interest rates, when the government of India was getting loans at very comfortable interest rates. We need to take some lessons on how economic policies in this country prevented state governments from more effectively intervening in COVID situations. I'm not putting the entire blame on the government of India. I'm just saying this is a new thing. We're quite unaware of the dimensions, scale, so one can grant a lot of margin for all of that. But one cannot pretend that ultra-neoliberal policies of the regime had no impact on the enormous costs of COVID in the population. There is a need to rethink this process, rethink the model, as Ratin Radha was saying. We need to rethink the model. It need not be state-dependent or government-dependent, but we need a path of development that relies on local initiative, decentralization, much greater generation of value addition at local level, something that the Kerala government has been trying out, something that's been talked about by many of us. This is where the small scale and medium scale industries come in. This is where the small and medium farmers come in. This is where they need to cooperativize and effectively implement cooperativization comes in.
Hello.
So some of these issues really have to be addressed in the coming period. But since most people have covered most points, I only want to say that we should not be complacent about how we handle it. Granting that this is a completely new phenomenon, granting that our information basis wasn't very good, we still cannot deny the additional costs imposed on our people by, I mean, even the vaccine policy, back and forth. Certainly, it's completely pro-corporate. And then when put under pressure, all right, we'll take the expenses, we'll bear the expenses. So a lot of flip-flops and a lot of politicking on these issues has taken place. I'm not going to, indulge in blame game and say X or Y is responsible, but certainly the union government did not distinguish itself particularly in this whole process, even granting this is a completely unknown phenomenon, and much of that had to do with the heritage of economic policies pursued earlier, as well as the incredibly difficult nature of the pandemic that we are dealing with, of which we know very little even now in terms of how economic policy should handle it. But it was criminal that we had a 4-hour notice for a lockdown, which did not give the migrant workers any scope for finding a place to stay, for getting food. So they had to travel long distances. I mean, we leave aside the absurdity of putting, sanitizing them on the way in some stations. But seriously, there was a real lack of human element. What I think in a way, Ratin put it very nicely and said, kind of low fraternity economy, low solidarity economy. We need to really rethink our values, really rethink collectively in terms of common good and not simply in terms of the ultra neoliberal notion that allowing people to maximize profits will take care of everything. It's just not going to happen. That's a lesson I draw from COVID, that we need proper, efficient state intervention without taking away the role of the private sector and the private players, and also without ignoring the actual producers on the ground whose demand should become the centerpiece of our planning and work, which is the point that Ratin was making. So I think we need to take from whatever earlier speakers have said, but we need not feel the necessity to defend the union government for the way it handled the pandemic. I certainly don't defend it. Let's put that on record.
Thanks, Dr. Atreya. For today, we heard very different opinions from expert economists. While managing the pandemic, we doctors had entirely different opinion. We never agreed on anything. We never agreed on masking. We never agreed on most of the international recommendations. And even the simplest masking policy changed over the time. Almost every month, we were changing our recommendations. That's what COVID pandemic taught us. We humans know little about the secrets of the universe. And today we learned that even there's a significant difference of opinion on how a pandemic can be managed in any country among different economies. I started the question with Dr. Mahajanji, and I will ask two questions, Dr. Mahajanji. What will be our way forward? What will be the strategy our government will be following to revive our economy, and also regarding the healthcare infrastructure? And second question will be we followed, in my opinion, we followed a good strategy of encouraging our Indian vaccines, and we were not ready to be bullied by the Western, vaccine, big firms. And we would like to hear opinion on these two important issues.
I'll take the first, second question first. Definitely, we have done much better than any other country, especially amongst the developing bloc, as far as the vaccine part is concerned. And as you have rightly said, that we didn't accept any kind of bullying by anybody, and all sorts of things we were hearing that this company will make our policy bend, but that didn't happen. And I don't agree with the view that we have a large population. We have problems with regard to the vaccine production. There were problems of raw material, the problems otherwise, but we have been successful in giving free vaccine to most of our population. So that way we have done much better, and we need to do more, especially in terms of the COVID medicines. Uh, and something has been done, but I'm of the firm opinion. Yes, we should pursue the TRIPS action further, because this WTO ministerial is nearing, and during this period we should make efforts to pursue the other countries, those who are blocking the decision on the TRIPS, the patent-free vaccines and the medicines, so that we should follow. The second, what should be the way forward? I have already indicated that in my earlier remarks. Yes, the COVID has given us several lessons. We have seen that the type of model which we had adopted for in terms of the growth, and I am of the firm opinion that GDP growth model is not the answer to the ills of this country. We have seen that despite this growth, high rate of growth, I am ready to contest any questions on that. Our labor has not been benefited. I am of the firm opinion, and this is backed by the data of ASI, Annual Survey of Industries, that there has not been any what you call significant increase in the wages, the real wages of the workers. And at the same time, if you look at the latest data of NSSO, latest data and the data which was published by the results which were published by NABARD regarding the rural households' incomes, that clearly shows that the rural-urban divide is on rise. The incomes from agriculture, they're not sufficient for the farmers to sustain, and therefore this pandemic has taught us a lesson. Yes, we should change our mindset. We should change our the way we function, the way we run our economies, and that's the reason why the government is now firstly they said yes, make in India, but they understand that make in India is not enough. Therefore, self-reliance is the only way. But self-reliance is not the Nehruvian type. The self-reliance of the decentralization, by way of decentralization, the self-reliance by making our villages self-reliant, self-reliance by creating more jobs in the villages so that they are not forced to go out in search of the jobs. We can have decentralized production model by way of providing more and more jobs at the village level, may it be the poultry, dairy, so many other jobs can be created. And we should reduce our dependence on, as Ratin Raji was also saying, that we can have the local production, and that can help us reduce the prices of the commodities which we are paying to the multinational corporations. And the API is and the dependence on the China has been enormous, and we must reduce that, whether it is pharmaceutical, whether it is the telecom or electronics or chemicals, and that we can do. And as Dr. Rangarajan had rightly said, the policy of production-linked incentive schemes is something which can produce real good results. let's be hopeful. But this has all come because we have learned a lesson from this pandemic. Thank you.
Thank you, sir. Other respected panelists, would you please like to add on? Dr. Atreya would like to make a comment.
Yeah, you see, much of what people are saying they learned from the pandemic, at least a good part of that has been articulated by other economists much earlier, throughout the neoliberal period, right from 1991 onwards, and more especially from the ultra-neoliberal period from 2014 onwards. Even now, all the rhetoric of Atmanirbhar and self-reliance is accompanied by a complete handing over of India's assets, resources, to global capital, including global capital, in terms of the way you deal with the mining sector or mineral resources or other parts of the economy. Likewise, many other dimensions. I'm surprised that while Dr. Mahajan is very correctly making a number of important points, he is not at the moment alluding, for example, to the handing over of major infrastructure assets to a handful of big private entities, or handing over of our resources in the name of Atmanirbhar to external agencies. So these are things that need to be questioned. And I appreciate what he's saying. So can we now think of a more inclusive, not insulated, but a more India-oriented model of development where we look at employment as an important objective in its own right, and look at local production as a necessity and a desirable necessity in its own right, just so that people have some greater sense of control over their lives. If you look at Kerala, and one of the better performance in the pandemic also has to do with enormous local involvement, right from the panchayat onwards. So this is not new to those who have been committed to decentralization for a very long time, but it's good. It's good that everybody is saying it now. I hope the government will listen to Dr. Mahajan and start doing the kinds of things that he's talking about, but it must also then address the issue of its great fondness for both Indian big capital and global big capital. These are issues you can't run away from. Even on the question of vaccines, when you had the possibility of several public sector units which could have been pressed into vaccine production, we were such great elections there to put them in. So there are issues. Maybe I don't know some of the things that are happening behind all this. Dr. Mahajan certainly is in a better position to know. But I think all of us are coming to a consensus of needing to rethink the whole model of development. That's a very positive thing. I think we can take it forward rather than fight about who was right and who was wrong. I'd certainly like to do that. But I'm not going to let pass my assessment of what the government has been doing. I'm sorry.
Ratin Roy ji?
Yes. No, I must say that I've known Ashwini now for many years. And he is no automatic defender of government policy. He calls it out, and I suspect that he may not say so, but he will be quite in sympathy with many of the things you have said, as I am, Dr. Atreya. I think we have to recognize 2 or 3 other realities about India. Dr. Mahajan, you and I have discussed this. You did not say anything. But it is indubitably true that while this government has a very clear societal ideology, and ideology is very important. This is an ideological government. Please make no mistake. This is not like Congress. This is not a transactional government. And please believe me, ideology is very important in economics as well. You have to make choices in economics about who you will produce for. And those choices will decide what you produce and very often how to produce. So the ideology of this government on economics is multiple. And at one end, you have people like Ashwini ji, who are Swadeshi nationalist economists, with a very healthy, I believe, disdain for, what I would call commonplace neoliberal rhetoric. He and I worked together when that disastrous attempt to bring sovereign bonds into this country was instituted. And I'm glad to say we succeeded. And then I learned that perhaps very often the uncertainty about economic policy is precisely because this government and the party that backs it, the BJP, does not have any economic ideology of its own. So it's constantly reinventing it, not true of the RSS. And I used to get puzzled at the beginning. I said that, Dr. Deendayal Upadhyay mentioned Antyodaya. Why is this government ignoring it, as you're saying, and providing, sort of specialities for big capital, etc.? I'm in London at the moment, and on my tourist list of things to do is to go and see Adar Poonawala's lovely new house, which he has built on the proceeds of his vaccine profits. I really want to see it. I'm told it's as good as Ambani's house. That should be interesting. Another tourist map. London is full of sort of Vijay Mallya, that kind of thing. So I think there are three things that this government really needs to correct. I'm so happy Ashwini said that they need to correct. One is they have to correct the automatic tendency that governments in India have to favor big capital. I wouldn't say it's a political problem. I'd say a large extent it is also due to a certain civil service indoctrination, which has gotten worse over the years as India has liberalized, where they know that their larger post-retirement interests lie in servicing big capital and they do it, right? Second thing is we have to end this hypocrisy that we have in this country. And this is very important. I think I completely agree with Shamika. And I would say as a macroeconomist, I feel guilty to not taking healthcare and human capital seriously enough. Since we're all being honest, I think Shamika's lesson is the salutary one. When I was looking at India's output demand composition problem, I began to realize the huge potential that investments in healthcare and education had for both employment and a different sort of economic model. And I think I have not been as aggressive about it as the past. What I've learned in the pandemic is resources need not be a constraint. We have the money. But in deciding what we want to do, I want to say this to doctors. See, I don't understand this model of healthcare in India when it comes to private health. So I go to Apollo Hospital and I find all the posh bits of it are open to me because I pay. Then under the stairs, I find a small room saying economically weaker sections. And I was given to understand that the whole hospital business was supposed to have been, they were supposed to be given free land, free this and free that, so that they could serve the people at affordable prices. Then I find another lesson from the pandemic that all these private hospitals are complaining that our medical tourism is over. So are we saying that the private healthcare system in India, top end, was reliant on medical tourism? Then, of course, I got a lot of comfort from seeing the good things that happened in Kerala. But all I'm saying is that there's a question of institutional economics here, which we economists don't know much about. And this is where I think the medical community can also come together and help. We are all, I think, grappling with what, now that we are saying we can afford better healthcare, it's going to be the spirit of the economic model. What is the institutional mix that we need to deliver healthcare in India? What is the mix of public and private in the sense of, I'm not convinced that insurance is going to solve our problem. But then I also understand we do need private investment in healthcare. So how are we going to manage this? This has to be a central question of Indian economic policy making going forward. The pandemic, I got very confused signals during the pandemic, apart from Dr. Poonawala's lovely house in London. The other question we have got to understand is one Dr. Atreya touched upon. And here I have some sympathy for the government. This government was not a pro-privatization government. And I would presume to say that given that luminaries like Dr. Mahajan are at the back of this government, it continues not to be by instinct a pro-privatization government, in which case, why is it privatizing? It is privatizing because, as I've been pointing out, it's the equivalent doctors of a silent heart attack. Government of India, in particular, has been going through a fiscal crisis of increasingly worrying proportions since about 2010, after the GFC. It never really came back. And I think the last 4 years, the fiscal crisis has become even more worrying. 70% of our borrowing is not for investment. It is for meeting regular government consumption expenditure needs. 70%. That number was 68% 10 years ago. So it's a bipartisan. It was 3% in 1981. It is about 18% now is for consumption in 1991. It is now 70%. So, the central government's ability to undertake public and capital investment is highly limited unless it is able to rejig its assets. That took a long time for the government to accept that it was broke. I was personally privy to this in the early part of this government, and I'm glad they've accepted it now. But then there's a second problem which I want to point out using this platform. My learning from looking at government and the finance ministry was that, these are very complex things to do. Asset monetization, I do not believe that the government of India has within it the ability. It has good leaders. I mean, I think the three bureaucrats handling the finance ministry today are some of the best I've seen in recent times. But below that, the structure is hollow. It's also true of the health ministry. It is true of most government. There is no ability to handle complexity. So you can do Kumbh Mela. It's not a complex task. It's a big task. You can even do vaccine. It is not a very complex task. It's a big task. The size of this task, the scale of the task is big. It's not a matter of high complexity. Disinvestment, privatization, asset monetization, completing and finishing an airport on time, understanding how to build a healthcare system. These are tasks of huge complexity. And we don't have capability within government to undertake that. Do we have capability in India? Yes. Is this government able to bring to that capability? No. Partly because of a personality cult, which I think is very unfortunate. This is the office of the Prime Minister is not a personality-driven office. And I can't tell you the amusement on the face of the immigration officer at Heathrow. When I showed him my vaccination certificate, he said, "What is this?" I said, "This is my vaccination certificate." He said, "Who is this bearded man?" I said, "That's the Prime Minister of India." So why is he on every certificate? I said, "Oh, ask him." I don't understand. I thought this only happened in communist countries. Anyway, so that has led to a word that the BJP is very fond of. I think an inability to do the kind of bhagidari, partnership, that any good political party, any good cadre-based political party should do. Now, cadre-based political parties, Dr. Isaac should know, he also belongs to one, are instinctively suspicious of expertise, because experts can be Trojan horses, experts can be all sorts of things. But I think this government has no choice. They will have to reach out and get the kind of expertise into the conversation that will enable them to, I think, take better decision-making. And that is a common collective challenge forward. I'll give you one final example. PMO called me about 2 weeks after the pandemic started to some meeting. And they said, doctors will be there. I said, Baba, what do I know? All the doctors happened to be heart surgeons and one diabetologist. So I was really confused. So what is Trehan and Devi Shetty and some diabetes guy came from Chennai? I said, where are the epidemiologists? Where are the infectious disease experts? I said, no, we've called doctors. See, we can't afford this anymore. We cannot afford to be so naive and so, how do I say, childlike about how we view expertise and how we channel it. Complexity is India's biggest challenge. And in adversity, we will have to address complex issues without being afraid. And there, I think we need some institutional development. So I'll stop there. I may have to leave in 10 minutes. Just wanted to thank all of you and the doctors here for your patience in listening. And also using this platform for having been absolute, I've seen that firsthand. I was in Landaram Hospital for 3 weeks. Absolute heroes during this COVID pandemic. I've seen the way you've worked. I've seen the way you've sacrificed. I've seen the fear in your eyes when you had to deal with things that you didn't know about. And I've seen the courage with which, nevertheless, you went there and dealt with them. Proud of you. Thank you.
Thank you, Dr. Tinji. Dr. Shamigaji had to leave the meeting. Of course, the meeting went on for a long time. Other panelists, any other comments?
Just one line, that
Yes.
the fiscal crisis of the government was not entirely beyond its control. A lot of it was self-made with enormously unnecessary concessions to the very rich and the very powerful.
Not just, I must say there, while I agree with you, not just this government. I would say after the United Front government of 1996.
Yeah, absolutely. 100%. I agree with you. 100%. I mean, this is neoliberalism and this is ultra neoliberalism. So what do you have?
Isaac, sir, raise hand. Yeah.
There are certain fundamental differences in approach to the panelists. That cannot be bridged immediately. I don't intend to. I don't want to add or not. But everybody is agreed upon the need for inclusive development. And among the various components of this inclusive development, everyone is totally in agreement that health should get a priority. What should be the percentage of our GDP that we should set aside for health, so that healthcare is available to everyone? What should be the percentage of our GDP that we should set apart for education for everyone, so that we have inclusive development? A minimum social security. Now, I think it should be possible for us to calculate. And once we do that, then there is the issue that Atreya raised in the last one. Shouldn't we ensure the state governments have sufficient revenue to meet this minimum requirement? This is the biggest issue. You cannot shirk away. After we agreeing upon all this, because we have a national law how to make budget. It says you cannot borrow to spend on all these issues. for your health expenditure, revenue, education expenditure, welfare expenditure. You can't borrow. Which would mean that your revenue receipts should meet this minimum that we dictated. The trouble with Indians, when we look at aspire, what should be our minimum needs? Though we don't think about Nordic countries, we would like to have somewhere in between. But we are, if you take a tax or revenue GDP ratio, it is lowest in the world, even worse than our counterparts in the emerging economies. And something has got to be done on this count if you are serious about addressing the challenge of inclusive development, challenge of future viruses coming and so on. Thank you very much.
Thank you, sir. That is a very interesting discussion, more than 2 hours. Actually, to be frank, when I invited economists belonging to different schools of thought, ideologies, I was a bit worried, because when we doctors have a meeting of different specialities, we never agree on anything. At the end, it will end up in I walk out and a lot of, arguments. But, economists at the end, I was really surprised, even though there was a difference of opinion in the beginning, at the end, everybody is speaking the same language, the same way of, what's good for our country. And that it's great to listen to all of you. We medical community are really grateful to the big economists in the country coming forward and discussing how our country can take the post-pandemic economic scenario forward. I will hand over the mic to our colleagues from GCCMC. Dr. Vijay?
I think we should keep in touch. Dr. Mahajan, nice to see you.
Hello.
Yes, Vijay.
Yeah. So again, this was like any of your branded powerful panel. So we had a very insightful thing. So I thank all the panelists and all the senior economists for taking out time and really giving in a good session. These sessions would be has been recorded, will be available as a link, which can be circulated among the circle. Whoever has missed, they can be part of this. Thank you one and all again from GCCMC. Thank you very much.
Thank you all.
Okay.